Hi, everybody. I want to present Dr. Carole Linster, and it's a pleasure for me to present her because she was my supervisor and my mentor during my PhD, and also I stay as postdoc in her lab. So I need to thanks for the great time that I was having in her lab. And so, Carol, can you explain us why you decide to open a research line for Batten disease?
Mhm. Yes, so hello everyone. Thanks Ursula for inviting me to this interview and help raising awareness on Batten disease. So my group is working on inherited metabolic diseases, and so we were not working on Batten disease, more on other metabolic diseases, because our background is more enzymology, biochemistry. So we work on new type of enzymes, but always in the context of inherited metabolic diseases. And but then there was a member of a Batten Disease Foundation who passed by the institute and gave a presentation here on Batten disease, and it was the first time I got aware about this disease. And from a scientific point of view, I got interested because several of the Batten disease genes have still a function of still kind of an uncertain function. And these are the genes, especially if they are involved in metabolism, that my group is working on. And a second motivation was that also several of these genes are very conserved, which gives us the opportunity to create genetic models in simpler organisms in the lab to model these diseases. And so these are 2 points that attracted me from the research side, and where I thought that with my group I could contribute to that research. But I have to say also on a personal side, this when I saw this presentation was exactly around the time when I became a parent for the first time. And I mean, I was really deeply affected by seeing how this disease develops in seemingly perfectly healthy children. And then, I mean, starts and takes a course that for the moment we cannot do so much about. And I cannot even imagine how this must be for the families. And so yes, if I think that was also a great motivation, and if there's anything that I can do to contribute to changing that situation in a certain sense, then I think it will be very rewarding.
Nice. And I think also something that I learned in your lab is that there is a strong contribution from association and foundations on research. So, how this impact in your research?
Yeah. Yeah, so I have to. So I don't know how it's in other countries. At least here, I mean, Luxembourg, the research field, or it's biomedical research is still relatively young, and I have to say, like, via the government or the traditional channels of getting research funding, so from governmental agencies, etc. Um, and I think in many other places, rare diseases are certainly among the diseases where it's like still the most very challenging to obtain funding. And I think, like, in terms of the support that we received, luckily from foundations, it enabled us to do things. I think we could never have developed the rare disease research to the level that we could now, thanks to foundation support. And here I also have to thank really active staff members of our institution who organize fundraising activities and who acknowledge the need. I mean, the great challenge that rare diseases pose for the families, for the society as a whole, and they help us a lot with that. So yeah, I think it was a crucial contribution. And I think also, like, the way that you approach the work when it's supported by a foundation is different. It confers a greater sense of, an even greater sense of responsibility, I think, in the feeling of giving back, that you know, you want to give back. for the trust that was put in you. And what I also think is that often the foundations, they bring you actually much closer to the patients and the families and their needs. They increase your awareness. And I've seen for myself, and I've seen for members of my group, that this is often a big motivational factor in the research, an additional motivational factor to, the passion that we anyways have for science or research.
Yeah, here I need to admit that my PhD was completely funded by ATOZ Foundation, Luxembourg Association.
Yes.
And indeed, we could do work that I don't think will have been funded by the government or by other institutions, because all the model we didn't have preliminary data. We were working very simple model organisms that maybe some scientists will not like it.
Yes.
And I think we were able to build nice results and consistent results to go later to these institutions and get funded.
Exactly. Yeah.
And I think we need to highlight this the work of this foundation and founded this kind of science that have no opportunity to big institutions because it's very competitive.
Yes, exactly. Yeah, true.
Yeah. So what do you think about the awareness about rare disorders in Luxembourg? How it is now, the situation there?
I think, I don't think it is yet having, really a chance compared to other more common diseases. I think there is really great work done by an umbrella patient organization that is not focusing on a specific rare disease, but they organize huge campaigns and go out, reach out. So I think they make a great job, and that starts. We have a little bit of a participation in Téléthon, which is this what has been started, I think, in France, but where towards the end of the year there are events also organized for raising awareness and raising donations. But I think there is a lot more that can be done. Our funding agency, our national funding agency, through them now we also got the opportunity to organize a rare disease activity where we show our research and why we do this. And I think we have thousands and thousands of children and students that pass by, and I think that's also very positive, because it gives us so there are activities that are organized, but of course it's difficult in terms of the scale. I think it's still small compared to what is done in the context of other more common diseases like cancer or
yeah, actually today we were discussing with the Bit-Patent Association, and indeed so patent disease is from the rares a bit the most common. And there are not so many associations there. The associations are not so well organized like here in the Netherlands, that we have an association that is trying to help researchers and connect the research with the patients. And in Germany we have also an association that they are actively working around the world to try to create awareness. But if we go to another countries, they are not so organized associations like here. So this is something great from the Netherlands, I need to say that.
That helps.
These are the associations that go and talk to the scientists and try to do the connection and try to look for funding that sometimes the scientists we don't have by our own.
And in my experience, what has helped a lot in terms of, it's also that finally there is a bit more support and programs within the European funding schemes that actually connects also like European groups together to, at least there is a something foreseen now for rare disease research and as well. And I think this increases, however, the activity in that field.
Well, thank you very much, Carole, for helping us in this 24-hour challenge for Batten disease. So we are trying to create awareness and to spread spread the knowledge about this disease.
Yeah.
So
yeah, it's
know about this.
Very good. I congratulate you for that activity and wish you much success in raising awareness. Thanks again.
Thank you.